Coming up, we'll be on location at the Gene Walter Infusion Center here in Catonsville, Maryland, discussing infusion therapy, the latest advance in health and wellness, and how it can effectively treat many health issues and improve your overall health with two of this area's top doctors, Dr. Nasseri and Dr. Jeffrey Landis. Dr. Nasseri received his medical degree from Ross University and completed his fellowship at University of Virginia and is currently the chief of rheumatology at the prestigious St. Agnes Hospital and the Union Memorial MedStar Hospital as well. Dr. Nasseri is widely recognized as one of this region's top doctors. Dr. Jeffrey Landis is the medical director at the Gene Walter Infusion Center and is widely recognized as one of this area's leading doctors as well. Welcome, Dr. Nasseri. It's a pleasure having you on our program.
It's good to be here. Thank you.
We have a lot to talk about. We're going to hear from some patients of yours a bit later as well. But I wanted to begin, if I may, Doctor, by having you please tell us about one of the latest advances in health and wellness, which is infusion therapy. And can you tell us how it works and all the folks that are benefiting from it?
Definitely. So as you said, there is a new trend of treatment for patients with autoimmune process. It's an autoimmune inflammatory arthritis, autoimmune lung disease, GI diseases like Crohn's, ulcerative colitis, and so forth, asthma patients, multiple sclerosis. So there are new type of medication that involves your immune systems and how to shape the immune system response. These treatments, most of them are given by IV type of infusion. So in our offices, locations that we have, 5 current locations in this area, we provide the infusion services for this type of chronic autoimmune disorders.
Very interesting. So as you just said, it's an IV infusion therapy.
Correct. Most of them.
Yes. And as far as some of the problems of the that it can address, that it can help people with, I know you touched on a few a moment ago. Are there some additional problems as well?
Correct. So just to name a few, rheumatoid arthritis, lupus, refractory gout disease, multiple sclerosis, refractory asthma disease, inflammatory bowel disease such as Crohn's, ulcerative colitis, and a few more.
So quite a few problems
Yes,
that it can help folks with.
Yes, indeed.
And I understand it has a very big wellness component as well as improving our overall health as well.
Exactly, correct. Yes.
Can you tell us a little bit about that?
So basically, when these patients who have these chronic autoimmune disorders, they are usually very sick, they have a lot of fatigue, they have joint pain, and so forth. So these treatments allow them to come back to become normal again and function normally, and also to enjoy their life, their well-being, and they can do their daily activities and so forth.
Now, what type of infusions are given to address these problems? I know IV is one of them, as we mentioned a moment ago.
Correct, yeah. So this IV infusion, each disease has its own type of medications, which at this time, this program doesn't have enough time for me to go through all of them.
Sure.
But just to give you a few, for instance, infliximab or Remicade infusion, it's for diseases such as rheumatoid arthritis, Crohn's, psoriatic arthritis, ulcerative colitis. So there are many more infusion therapies that we do. It depends on the disease and their treatment modality.
And to improve the overall health and wellness, because that's another big benefit of the infusion therapy. It's to help people dealing with those issues that you talked about.
Exactly.
But it also has a huge component that really just rejuvenates us, refreshes us, keeps us overall in better health, and improves our wellness as well.
Exactly. I mean, those treatments allows for the individuals with these diseases to have normal life, normal functioning. Even 20 years ago, we didn't have this many options to treat these patients so effectively. Especially, for instance, in the case of rheumatoid arthritis, now we have so many options for treatment, which has enabled us to be very aggressive in treating these patients so they can have normal life and normal functions.
That's certainly good to know, Dr. Nasseri. I wanted to also ask you, for the folks out there watching, can you please describe the process that a patient of yours here at the Infusion Center would go through?
The process is very easy. All they need to have is to see their physicians, let's say their pulmonologist, their neurologist, their rheumatologist, and then once that physician makes that recommendation in discussion with the patient, and they make that decision that they want to have this treatment, then that physician can refer that patient to us with an order of what type of infusion that patient needs. Okay. And then our staff here takes us from there. We have a full-time nursing staff, and also we have staff here to talk, to discuss this in treatment with their insurance companies in order to get reimbursed on time and so forth, so the patient would not be in bind for any extra cost of the treatment.
So everything is streamlined, highly efficient,
yes, indeed.
All to the benefit of the patient.
Yes, indeed.
Now, how long does a session normally take for the infusion therapy?
It depends on the infusion. We have as fast as infusion therapy, half an hour, okay, to 4 to 6 hours of infusion. This depends on type of the infusion. Yes.
Now, as far as the number of therapy sessions that your patients come back to you for, again, I'm sure that depends on each patient.
That's right.
But in general terms, what is somebody typically looking at as far as number of sessions?
Most of these diseases are very chronic diseases, like rheumatoid arthritis, sure, like lupus. The more chronic or long-term these diseases are, the length of the treatment is longer.
Okay.
So I can tell you for rheumatoid arthritis could be years, but in a patient with gout could be 4 to 6 months of treatment.
Oh, yes.
Again, depending on the disease, the length of the treatment is different.
As far as who's a good candidate, and I put in the disclaimer that based on what you've told us thus far, a lot of people in the community can benefit from infusion therapy.
Sure.
You've already talked about the many common problems that it helps people that they're suffering from and how it helps them, but at the same time improves our overall health and wellness, revitalizes us, right? It's also a preventative measure by having infusion therapy to keep us, with our overall health and wellness where it needs to be when we move forward in life. But in general, who would you say is a good candidate, Dr. Nasseri, that can benefit from infusion therapy?
Well, usually, as I said, all these conditions most of them are chronic conditions.
Yes.
And usually these patients, they have not responded to the first or second line therapy, which usually is in the form of a pill. Yes. And these infusion therapies are usually the third line or second to third line therapy for these patients.
Sure.
So the physician who is in charge of treatment along with the patient, they have to make the decision of when is the good time for this IV infusions to start basically these treatments. Like for instance, I give you an example about rheumatoid arthritis patients. Usually these patients are, if the disease is not very aggressive, we start them with drugs like methotrexate or Plaquenil or sulfasalazine, which are pill medications. And then if they don't respond adequately within the frame of time, then we discuss about IV infusion therapy in those patients.
Oh, so as you just said, it's really like literally the third line of treatment.
It could be, yes.
Depending on that particular patient and how chronic their condition is and how it responded to medication.
And how aggressively the disease is, basically.
Yes, indeed. Yeah. And what type of results are your patients seeing from the infusion therapy? Because we're hearing a lot of great stuff about, from a lot of folks that come to you regarding infusion therapy.
Well, as I said, up to really 20 years ago or 18 years ago, I'm just giving an example with rheumatoid arthritis patients. Many patients with rheumatoid arthritis had a very bad outcome in a way that they had permanent disabilities, permanent joint defect, and this has changed significantly since the infusion therapy has come on board. No longer we see those type of severe damage with rheumatoid arthritis patients. Patients are much happier because they can do their daily activities. They have less pain, less swelling. And with other conditions, the same way as well. For instance, with multiple sclerosis, we have very new medications that really has changed the way the MS patients or multiple sclerosis patients, they respond to this treatment, and they have almost normal life once they get treatment with this type of treatment.
Yes.
So it really has changed, and this is the era of new change and new drugs that has overhauled the way we see and we treat chronic diseases.
Yes, indeed, and all to the benefit of the patients, because it's really advanced and it's evolved.
Yes, exactly.
As far as what the traditional treatments were for so many years. And unfortunately, as you touched on earlier, the ones that suffer from the chronic conditions, the ones where it's very advanced and strong as far as whether, whatever the issue they're going with. The infusion therapy seems to be a wonderful treatment option to really help them.
Yes, indeed.
We're now going to hear from some patients of Dr. Nasseri.
My whole body was aching, but after Dr. Nasseri diagnosed me, he decided to try different medications on me. So he's tried them, and it seemed like nothing seemed to be helping me. And then he probably thought, well, I better start her on infusions. So that's what he did. And I'm telling you, it's been the biggest difference since I've been coming to doing the infusions. And I feel almost 100% better. When I first met Dr. Nasseri, I found him to be a very kind and caring personality. And then as I got to know him, I thought, this guy's really intelligent. Because everything I asked him, he gave me an answer. And I also noticed that he's really up on the newest technology available. And then I see he proceeds to get this new technology in his office. So now we're happy to have a nice, large and comfortable infusion room. We love it. I can't say enough good things about the staff. I feel like they're part of my family now. They greet me, they're very professional, but friendly. So I just feel real comfortable coming in here now. I think he's one of the best rheumatologists in Maryland. I would definitely recommend him.
I have osteoarthritis in my knees, and Dr. Nasseri is the one who gives me my shots and draw the fluid out when I need it. Then I found out that I had rheumatoid arthritis as well, so he's been trying to give me treatments for that. And then we decided that we would do the Myers cocktail, and I found that to be wonderful. I feel so much better since I've been taking it. I have more energy now. I don't just want to sit around. I have a lot of energy, which makes my husband work a lot. Dr. Nasseri, wonderful person. I call him Dr. Necessary because he takes care of everything, everybody. He's a wonderful doctor. I would recommend him for anybody. He is wonderful.
We're now back with Dr. Nasseri. I must say the patients are very happy with the results. Some great work indeed, doctor.
Thank you.
Dr. Nasseri, we are literally out of time, but I wanted to ask you before I let you go, you and your practice and your infusion center here really are helping so many folks in the community. People are driving some distance even in some cases just to come to you and your infusion center to get the benefits of infusion therapy. You and your staff have developed a reputation for excellence. Not only are you one of this region's top doctors, but your staff and all of you really believe very strongly in patient care. And that's why the patients love you all. And I just wanted to ask you what you feel helps separate you and your practice apart from many of the others.
Oh, well, thank you very much for those kind words. We take pride in taking care of our patients the way we take care of our family members.
Right.
And I have been blessed to have a team together like this. And we have very dedicated staff, good nursing, good physicians, our front desk staff, medical assistant staff. They are all very dedicated to our patients. And we take a pride of that. And we are very, very, very appreciative of our patients and the community who have given us our support all these years. And we are hoping that in the coming years we will continue to have their support and to be able to help many more in the community.
Yes, indeed. And you also have 5 locations,
Yes, indeed.
all to the convenience and benefit of the community.
Yes, indeed.
Can you please mention beyond this Catonsville location
Sure.
where the others are for the folks watching?
Definitely. So we have in Catonsville, which is in this location. We also have Glen Burnie, which is very near the hospital. We also have downtown in Baltimore, which is in the campus of Union Memorial MedStar Hospital. We have a location in Columbia, and we also have a location right near Franklin Square Hospital in Rosedale.
That's wonderful. So
Yeah.
people from throughout this region
Yes,
can
indeed.
go to the location closest to them and take advantage of all the benefits that infusion therapy provides.
Yes, indeed.
Well, on that note, we'd like to thank you, Dr. Nasseri, for joining us, educating us, being a guest on our program. It was a pleasure having you on.
Thank you very much. It was a pleasure being here.
And now we're going to meet Dr. Landis. Welcome, Dr. Landis. It's great having you on with us as well today.
Thank you very much.
Now, you are the medical director here at the Gene Walter Infusion Center, this beautiful infusion center that's really helping the community in a big way. A lot of people are realizing the benefits of infusion therapy, and I wanted to have you begin, if you may, by please telling us about the benefits of infusion therapy and your infusion center.
All right. For some of the infusions we give it for rheumatoid arthritis and psoriatic arthritis and stuff like Crohn's disease.
Okay.
These diseases used to be hard to control with oral medications alone, and they have discovered new ways of treating this disease with infusions, different antibodies that help decrease inflammation. And we've been starting doing that for rheumatoid arthritis, and we prevent deformities, and we prevent people from having ongoing Crohn's disease and stuff like that.
So those are some of the health problems that it can help people with. Are there others as well?
There's stuff like, well, there are other ones that are newer. They're for multiple sclerosis, allergic asthma that we'll be doing infusions for as well. There's ankylosing spondylitis. There's one for gout we have that's actually not like the others. It's more of an enzyme that breaks down the uric acid. That's long-winded, but it's a little bit different than the others. And we have one for lupus as well.
Oh, very interesting. And yeah, because infusion therapy is really caught on. I mean, as I mentioned a couple of minutes ago, a lot of people are realizing the importance and benefits of it. And you guys certainly have that cutting edge center here serving this entire community.
Yeah.
And it's become really big in the health and wellness arena.
Yes, it's helped out a lot of patients over the years.
Yes, indeed. Now, what's the process that a patient will go through when they come to you as far as the infusion therapy is concerned?
Well, they come, they get evaluated, we make sure they have the right type of vaccinations, and we make sure they have the right labs done. And then they're evaluated by the doctors, then they're taken to the infusion center, and our nurses will start them on an infusion. They'll put in an infusion chair, and the nurses will start them up on their infusions.
Yes, and as Dr. Nasseri said at the open of this interview, some major differences as far as benefits for patients to come here to your infusion center as opposed to going to the hospital. They really get that one-on-one attention here and a whole host of other benefits as he mentioned.
Yes, that's true.
Now, how long does a session typically take for infusion therapy?
It depends on the medication. Some of them take like a half hour to get done, and one of them takes up to 4.5 hours to get done. But that's more rare. It's more on the hour side that we get the infusions done.
And again, as you mentioned a moment back, it depends on each patient, right? His or her situation.
And the medication we're giving.
Yes, indeed. And again, I put in that same disclaimer before I ask you the next question. That is, I'm sure it depends on each patient. But in general terms, how many therapy sessions does it typically take to get the desired results for your patients?
It takes about a month for a lot of our infusions to make an effect, and people come back and say, yeah, I feel great, I'm doing good. So the results aren't immediate, but
Yes.
they come.
Yes, indeed. And who's a good candidate, Dr. Landis, that can benefit from infusion therapy?
Almost anybody who has the disease that the medications are indicated for are good clients for them, I should say. It all depends on what they've been on before, too, in terms of what the insurance will cover in terms of that as well.
In addition to what you said, I would think another major benefit, and we've heard this from other patients, is that it also re-energizes them, rejuvenates people. It really brings more vitality back, if I may say and use that word.
It gives them a lot of them their lives back.
Yes.
I mean, if you can't move, you can't go around because your joints hurt you so much, you're miserable. But if you get the infusions that we give here, they usually help.
Yes, indeed. Absolutely. And what type of results are your patients experiencing here at the Infusion Center?
Depends on the disease. I mean, if you're treating a Crohn's disease, their bowel GI symptoms go away. If they're having arthritic symptoms, their arthritic symptoms go away. And they go on living happy lives. All they have to do is come back for their infusions regularly, and they'll do well.
Yes, indeed. It really improves the quality of life as well.
Yes.
I would like to point out, Dr. Landis, that infusion therapy is certainly, as we touched on briefly earlier, a very innovative and highly effective treatment option. In your practice, your infusion center here in Catonsville, Maryland, has certainly established a reputation as being a top infusion therapy center for this region. I just wanted to ask you what you feel helps separate you all apart from many of the others.
So for us, the patients come in and they're generally happy here. They get like their individual care. They like our nurses. They're very friendly and happy, and they don't feel like they're part of a conveyor belt of here you get your infusion done and get out the door.
Yes.
We're just here, and then we pay attention to them. We watch them, and everybody seems to be happy.
Yes, indeed. You're getting great results. The patients love you all, and we're really happy we had you on today along with Dr. Nasseri. And on that note, Dr. Landis, thank you for joining us as well and being a guest on our program. It was great having you on.
Thank you very much.
Thank you. We're now going to meet Seher, who's the practice manager here at the Gene Walter Infusion Center. Welcome, Seher. It's a pleasure having you on as well with us today.
Thank you. Thank you for having me.
Now, you are the practice manager, the one who runs everything here at the Gene Walter Infusion Center. I wanted you to tell us about all the good stuff you're doing and what your job is.
Sure. At Gene Walter Infusion Center, we strive on making sure our patients are comfortable and are taken care of by our very friendly staff. We also have a very experienced and dedicated billing team who work very closely with insurance companies and patients to make sure everything runs smoothly.
Well, you guys are doing great work. You really are, and I love the fact on the financing side. You offer, can you tell a little bit more about that component of your benefits that you offer people? Because especially in this economy, you know, they can get those great infusion therapy treatments and they can do it through financing, that would help them.
Yes, we have a lot of different programs. We try to work with insurances in many aspects, but also we have care credit if any patients are interested in.
Okay, so it's nice to know you offer those options.
Yes.
That's why I appreciate you elaborating a bit more on that.
Yes, thank you.
And before we let you go, Seher, is there anything else you'd like to add?
And again, patients are our #1 priority.
Well, on that note, we'd like to thank you as well, Seher, for joining us and telling us a little bit about the Infusion Center from the practice manager perspective.
Sure. Thank you so much for having me.
Thank you.